It's a pleasure for me to have the opportunity to present our ideas, our approach about a more holistic approach when it comes to measuring the impact of health interventions. My name is Malina Müller. I have already been introduced, and the aim of today's presentation is I want you to understand that we really need a paradigm shift. We need a paradigm shift from costs when it comes to spending in the healthcare sector to them being seen as an investment into economic stability, prosperity, and social well-being. Second, we need evidence-based analysis. We need health metrics for smart and responsible investments. And I have also brought a few examples with me because it's not only a theoretical approach, we have already applied it. And with that, I want to underline that it is indeed feasible. What do I mean when I say I want to foster, or we want to foster, a paradigm shift? In the past, expenditures or spendings in the healthcare sector have solely been seen as a cost driver, as a problem. We have to cut the health expenditures. We have to reduce the costs. It has always been seen as, okay, our budget is draining. But we should see spendings in the healthcare sector rather as an investment. The health economy in general is a driver of growth and employment. And we can see that with health economic reporting that is already applied in various countries. We have a GDP contribution that is above average, and in some countries that equals the automotive contribution. So we see already the economic contribution of the health economy during that channels. But it's not only about the investments in the healthcare sector that trigger along the whole value chain an impact. No, it is also about the impact those invests have. Because when we talk about the health economy, the main aim is to improve health. So what do we generate when we invest in the health economy? We generate better health. And better health, as one also of the Sustainable Development Goals, SDG Goal 3, is the starting point of a positive feedback loop. When we generate better health, we can generate greater wealth. So this is fully in line with the SDG Goal 8. So we are then on track when it comes to sustainable economic growth and full and productive employment. And that, again, can generate more innovation and can generate more capacity. And it is not only about the costs that are reduced when we reduce the burden of a disease. No, it's about the productivity capacity that is free. And it is not only about the direct cost savings, but also about capacity due to a less pressured healthcare system, a less pressured system when it comes to paying sick leave, so we generate through various channels more fiscal space. And what do I want to say? Do I want to say that we should simply take more money in the hand and spread it into the health economy? No. We have to make data-driven, smart investments when it comes to investments in the healthcare sector. And in order to do that, we have to take 3 essential steps. You can see them here. First, we have to assess the health needs that we have. We have to measure the social burden, the cost of illness, and not only in terms of impaired quality of life, but we have to underline the productivity loss that is occurring due to bad health. This is the first step. Without knowing where the lack of health exists, we don't know where we should start when it comes to improving health. The second step then must be to measure the social impact of health interventions. And I mean, not only interventions in terms of medications and drugs, no, it's also about preventive measures, the change of the policy, educational investments that foster maybe a behavioral change. So we have to consider everything along the patient journey. And then, in the third step, we can quantify the economic impact of these investments, the return of investment. And we have already been promoting these idea of, we call it health metrics, or maybe in a company system you would call it KPIs. So we need the key performance indicators. The health economy itself is one of the biggest sectors worldwide. So we have to maybe also measure it like that. And these are the three essential steps, and during the presentation I will also provide you with some examples for each of those three steps. Because we are really convinced that we need such metrics and that they must be integrated in the, for example, EU semester to really generate a shift when it comes to health. Why is it so important to measure the return on invest? I could show you or underline the idea with even more, let's say, arguments, but I want to focus on the three most important things. We have limited budget, we have limited resources, and we have to optimize how we allocate this limited budget. And with the return of investments, we equip policymakers with valuable tools to make most out of the limited healthcare budget. So it is about defining the interventions with the best value that aligns, and that is why the first step is so important, measuring the burden, with the need that is there in the population. This is the first step to foster a more efficient healthcare system. The second point is, with return on investments, we promote an evidence-based governance. Why is it so important? We can't do anything without good data, right? And everybody is talking about, evidence-based policy making, but in the end, we are not really doing it. And we really have to promote that. And with data on effectiveness and efficiency, we support the development of policies that are grounded in science. And this should be the starting point. Not only the starting point for smart investments, but also a trust, or the start of a, let's say, trust journey when it comes to explaining investment decisions also to the society. So these are the first 2 points. And the third point is that we also have to enhance accountability and sustainability. So when we have the return of investments, the stakeholders are really, they can be made accountable of their investments. They can be asked for the basis of their decision. And it really emphasizes the importance of not only measuring the direct impact or the direct costs or the short-term costs, but also that we should have a broader view, a longer view when it comes to measuring the impact of investments. So these are the main reasons. And because we as a research institute, we are so convinced that this is needed, that over the past years we have used various channels, not only companies but also other associations and strategic partnership, and we really started it to make stakeholders understand or aware of the fact that we need such health metrics. And we are working in close collaboration with Harvard University in our role as a G20 health and development partner. And we have published a paper that is called "If we can't measure it, we can't fix it." Because first, we have to know what is the issue. Or if you want to frame it positive, if we can measure it, we can shape it. And this is, when we look at this level, this is the 4-step value framework that we suggested in this paper that we think is needed for resilient societies and economies. We have to address the rising disease burden, and we have to measure the return of health investments. And the first 3 steps that you can see here are the more classical points of view when it comes to the contribution of the health economy as a sector. So we generate GDP, we generate employment, and we are not only generating that directly in the healthcare sector, but along the whole value chain. When we invest in this sector, other positive effects are triggered. This is the more classical point of view, this is what I just said, but not even all countries are measuring that. And we want to go beyond, and this is also beyond cost effectiveness. The output of these investments, the social impact of the medical interventions, this is what we have to measure. And we are promoting this value also, or we have promoted this also at the Health 20 Summit in Geneva, and we have already presented this idea to the EU semester. We are convinced that, as I said, we have to measure the social burden, and we also have to capture the social impact in terms of the impact on human capital. This is very important, and we have to understand that the private and public investments in health or healthcare sector, it is really a sector. What do I mean when I say human capital? I'm not only talking about the direct paid effects or the productivity in the labor market, the paid productivity. I'm also talking about unpaid work activities. So people are productive in terms of unpaid work activities during their whole life cycle. And to make it a little bit more tangible, we need all the people to take care of our grandchildren. We need all the people to being fit enough to do informal caregiving. So these effects are also very important, and it resonates also very well with the, again, we have the word beyond GDP discussion that has been going on for several years, that with the GDP, maybe we are not fully capturing the wealth of a nation, because being in good enough health to contribute to unpaid work is also a sign of wealth. And I do not want to dive too deep into our method, but our approach in a nutshell, we start always with the health benefits. And this is most often a cost-effectiveness analysis. So it's not about abundant cost-effectiveness analysis, but really going beyond, making more out of it. It is more that happens when we create new interventions in the healthcare sector. We improve productivity, we improve quality of life, we reduce the direct costs, but we also took the pressure from the healthcare systems. This is always the first starting point. And then we measure in the next step the lost or avoided lost productive time to then, in a third step, monetize it. We have to put a price tag on the effects that are triggered by investments in the health. And now I start with the examples that I brought with me for the 3 steps. So the first step, as I said, we have to be aware of where is the lack of health, and so the burden or the socioeconomic burden of diseases. And we have calculated the socioeconomic burden of diseases of cardiovascular diseases in Europe. And when we include also the unpaid work effects, then CVDs generate a social burden equivalent to 4 to 5% of GDP. 4 to 5% of GDP. This is wealth we lose because the people are not healthy. And just a simple play, if we would prevent half of the CVD events, we would increase, or there is potential to increase our wealth by 2%. So there is considerable opportunity for disease prevention, and that includes all measures that can improve cardiovascular diseases. But going forward, because I think we have cardiovascular diseases already on our radar as a very pressuring health challenge, there might be other diseases that are not as much acknowledged as the big chronic diseases. And this is, for example, migraine. We did a study, a socioeconomic burden of disease study for migraine in Germany, and we found out that overall, 23% of the whole population suffers from migraine. And if you translate that into a loss of productive days, we come to an average of more than 800 million headache days. And this translates into, again, a real economic loss. And when I'm only considering the paid work loss, we have more than 500 million hours lost. And this equals almost 1% of the hours worked in Germany in 2017. So this is what we really lose. We have to make, or create awareness about that. And this loss, when we also consider the unpaid work, equals to 100.4 billion GVA loss in Germany. And when we translate that into more, let's say, tangible figures, it means that here we have almost 3% of productivity loss when we put it in the context of the German GDP. And it equivals also to the city of Munich, so with 1.5 million inhabitants standing still. 3.5 months, nothing is happening in Munich due to migraine. This is enormous, and this is what we don't have on mind when we don't capture the burden of disease. So it might help also to allocate health budget in a different way. And then I want to go over to the second step. So we have to assess the social impact. How can we assess that? There are different ways how we can assess that, but what we have done so far is, for example, that we have captured the social impact of new drug launches in Ireland, so the socioeconomic benefits. We selected 3 disease areas: cardiovascular diseases, cancer, and respiratory diseases, and we found out that through the drug launches that have happened, we generated a socioeconomic benefit of more than 50 billion over the period of 20 years. And without, or if we see the alternative story, that is no investment would happen, this loss would be there. This productivity would be missing in the economy. So if you want to rephrase it, this can also underline the cost of inaction, the cost of not launching new drugs. And I do not want to overuse it, although I would like to share even more examples. But when we talk about interventions, it's maybe also about an earlier, also than maybe medical intervention when it comes to diseases. What we have calculated, my dear colleagues, for example, is the impact of early intensified treatment in patients with type 2 diabetes in Mexico. And when we have a look of the highly debated early intensified treatment when it comes to the disease, we found out that over the period of 10 years, 54 million can be generated in terms of social impact, so in terms of paid and unpaid productivity effects, an enormous amount. And then we come to the most important point, I would say, and that is measure the return of investment. I know the slide is very loaded, very busy, so I just want to highlight the most important thing. So I already mentioned that it is not only about the social impact or the return on invest of medical interventions. It's also about other interventions. And what we have done for a specific program in Rwanda is that we have estimated or calculated the impact of water filters and cook stoves on health, and then the impact on the society through the improved health. And overall, with the investments we make, we have a benefit of almost $12 per person. But what is really interesting is that $1 we spend or invest in such initiatives will result in a return of a little bit more than $3. So this is a good return on invest, I would say. And this underlines that effects of healthcare interventions can be measured, also outside of the simple medical parameters, and that also simple and low-cost interventions can have dramatic life-saving impact and a very important socioeconomic effect. And such an approach can be adapted to any health-related large-scale investments interventions. And because I brought with me also the study of the drug launches in Ireland, I also want to highlight for sure the impact or the return on invest of these new drug launches. So for every euro invested in medicines in the 3 disease areas, almost 4 euros will be returned to the economy until 2025. So it's not only about the costs now, but the impact over a longer period of time. And we have to rethink how we value or see or evaluate interventions. And what are the key takeaways that I want you to take home or raise now in the discussions? We need a paradigm shift. We must see spendings in the healthcare sector not only as a cost, but as an investment. And we need evidence-based analysis. We have to measure the burden of disease. We have to assess the needs or maybe the costs of inaction. We have to capture then the impact of the action. And in the last step, capture the return of the action for evidence-based policy. And as last key takeaway, it is feasible. We have already done it. And sometimes we must be maybe a little bit more pragmatic when it comes to improving health for all. Thank you.
Okay. Dear Malina, thank you very much for your excellent presentation. And I might admit that it was impressive, the gains of the investment in health, in unveiling the total social value of intervention and investments. Do we have any questions? Okay, Yanis, do you want something to ask?
Thank you for your very interesting presentation, providing an international perspective on value beyond cost effectiveness. What I would like to ask, we saw application of this approach in Europe, in Africa, in America. Does this approach need to be adapted in order to take into account local needs or preferences, given that every country may have different social values? So if there was an adaptation of this tool before applying it to its case study.
Yeah, I think you always have to consider the environment that you're in. And when you start with the first step, so capturing the disease burden, the environment will reflect in the disease burden or in the different burdens that you can see in the specific countries. But the approach, I would say, or the steps that you have to take are the same. But what you want to emphasize really depends not only on the needs that we have assessed in the first step, but also on the general agenda of a country and also the social preferences. Exactly. Because this is what it is also about. Yeah? You have to convince the people that are living in the country too, and you have to underline that you are taking care of their desires and that you take the needs serious. Yeah.
Okay. Thank you.
Okay. May I ask you something? What are the best channels, ways to communicate your findings in decision makers? For example, in the government side of decision makers, from your experience in other countries?
Mm-hmm. So I would say, in general, it is very important to have the dialogue, to be in exchange with the various stakeholders, because every stakeholder has its own priorities and preferences, and in the first step, being aware of that and being open towards that is the first step. So listening also to the language that the others are speaking and being in exchange from the beginning on. And also when we work together with pharmaceutical companies, for example, we convince them to get into a dialogue with different stakeholders too, because it is often these against these, but we are all in this game. So we should maybe foster not only a paradigm shift when it comes to investment in health, but also how we can tackle that, how we can approach that. And I think dialogue, communication, and exchange is the best way to, in the first step, understand what the needs are, and underlining that there is a need is the first starting point for everybody. Everybody should be cautious or should be listening when we underline the needs that is in a society there. Yeah.
Okay, and another question. To perform your analysis, I suppose that you need a lot of data. From your experience in various countries, do you have access to this data, or do you find easy this data that you need for your analysis? Because in Greece, I can assure you that you will have a great problem, not only to find the data, but if we have them, we might have a limited access to them.
Yeah, I come from Germany, so when we have data, we will not be allowed to use them due to high privacy reasons. So yeah, it is challenging, and this must be improved. And this is also something that different stakeholders have to be willing to work on it. Mm-hmm. So again, we have to build a task force to generate the data, and it is a challenge to outweigh the privacy risks or data privacy points with the, let's say, the public preference or priorities. But without data, we can also, if we can't measure it, we can't fix it. That is the key, I would say. And it is challenging, it is getting better. We need more real-world evidence too. There are a few low-hanging fruits that you can use and make use of, but this is something we have to invest to. Yeah.
Okay, thank you. Mr. Margaros.
Thank you very much for this presentation. Let me just add a first comment that for Greece, we would have to adopt your title. From beyond cost effectiveness, we would go to beyond cost budget impact. Having that in mind, this is quite the discussion. So having this in mind and taking into account your experience with other countries, are other European countries or other countries globally that have managed to shift their mindset from budget impact or even cost effectiveness to a holistic approach, because this is actually the $1 million or $1 billion or whatever trillion dollar question. If they have done it, how they did it? What would you advise, let's say, the Greek decision makers how to change their mindset and go to the next step? Thank you very much.
I think in general it's a journey, and change will not happen overnight. This is the first thing. And I think countries who have adopted a more holistic approach, it did also not happen overnight. And I'm not a strategic political advisor, to be honest, but based on my or our experience, I think we should talk about responsible use of the resources available, and we have to highlight that there is a cost that you are responsible for too. So all the stakeholders that are providing solutions are solution provider, but often the regulatory bodies are only talking about the problem, and we are diving deeper and deeper into important but maybe too granular discussions about another sensitivity analysis, another discount debate, but maybe we have to go one step back and see the whole picture, and that is because of no access to treatments, you generate bad health. We have the inequality. Maybe you have to underline that and position yourself as a partner in order to reduce this burden and this cost.
Thank you very much.